External genitalia. Genital tubercle forms clitoris in female, glans penis in male. Genital swelling forms scrotum in male, labia majora and periphery in female. Genital fold or urethral fold forms labia minora in female, penoscrotal raphe in male. Indifferent structure in female, male. These are formed from this indifferent structure. Genital ridge, ovary, female, testis, male. Primordial germ cells, ova, female, spermatozoa, male. Sex cords, granulosa cells, female. Seminiferous tubule, Sertoli cells in male. Gubernaculum, utero-ovarian round ligaments, female. Male, gubernaculum, testis. Mesonephric tubules, eubufron, parufron in female, efferent ductules and paradidymis in male. Mesonephric duct, Gardner duct, female, epididymis, ductus deferens, ejaculatory duct in male. Paramesonephric duct, uterus, fallopian tube, upper vagina in female. Prostatic utricle, appendix of testis, male. Urogenital sinus, bladder, urethra, vagina. Paraurethral glands, greater Bartholin and lesser vestibular glands, female. Bladder, urethra, prostate utricle, prostate glands, bulbourethral glands, male. Genital tubercle, clitoris, female. Glans penis, male. Urogenital folds, labia minora, female. Floor of penile urethra, male. Labioscrotal swellings, labia majora, female. Scrotum, male. Boundary line between pelvis and perineum. Pelvic diaphragm, chiefly by levator ani muscle, separates the pelvic cavity above from perineal region below. Pelvic has viscera like urinary bladder, uterus, rectum. Perineum has opening of viscera like urethra, vagina, anus. Lateral pelvic wall gives levator ani muscle. Pelvic viscera support pelvic diaphragm, urogenital diaphragm, perineal body. Perineal body, central perineal tendon where all perineal muscles are inserted. Perineal body tear may cause prolapse of uterus, uterocele, urinary bladder, vesicocele, rectum, rectocele, urogenital diaphragm, sphincter urethra, skeletal muscle to control flow of urine, deep transverse perineal muscle present in deep perineal pouch. Perineal pouches, superficial perineal pouch, floor, collis fascia, roof, perineal membrane, contents, bulbospongiosus muscle, medial, ischiocavernosus muscle, lateral. Deep perineal pouch, floor, perineal membrane, contains urogenital diaphragm, constituted by urethral sphincter muscle, deep transverse perineal muscle. Skin, collis fascia, superficial perineal pouch, perineal membrane, deep perineal pouch, levator ani muscle making pelvic diaphragm, pelvic viscera. Important information. Vestibule space where opening of vagina and urethra present. Vagina passes through pelvic region, deep perineal pouch, superficial perineal pouch to open into vestibule. Ischiorectal fossa, space between ischial bone laterally and anus and rectum medially. Medial boundary, levator ani muscle. Lateral boundary, obturator internus muscle. Obturator internus, attached to ischial part of hip bone, covered by obturator fascia. Has pudendal canal in obturator fascia, contain pudendal nerve and internal pudendal vessels. Urinary bladder and urethra. Urinary bladder has mucosal fold to accommodate large quantity of urine called rugae. Trigone has smooth mucosa, no submucosa. Mucosa tightly adherent to detrusor muscle. Trigone inserted into posterior wall of prostatic urethra called urethral crust. Prostatic urethra also has a seminal colliculus. Internal urethral sphincter, smooth muscle sphincter, well developed in male, poorly developed in female, supplied by L1 sympathetic fiber which prevents retrograde ejaculation of semen into urinary bladder. Some important information. While doing lumbar sympathectomy, L1 sympathetic fiber has to be preserved. L1 sympathetic fiber cut cause paralysis of internal urethral sphincter which lead to retrograde ejaculation of semen into urinary bladder. External urethral sphincter, skeletal muscle sphincter, contributes to urogenital diaphragm, controls urine flow at our own will, present in deep perineal pouch, having floor of perineal membrane, controlled by pudendal nerve, somatic nerve, pudendal black, urinary incontinence occurs. Sagittal section of male pelvis.